It's the Brian Lehrer Show on WNYC. Good morning again, everyone. So public health continues to be a major battleground during this Trump administration, from trying to jail Anthony Fauci while downplaying the 1.2 million recorded COVID deaths in this country, to Trump's executive order yesterday, have you heard this yet, which, if it stands, would break up the MMR vaccine for kids into 3 separate shots, despite all the evidence that the current shots are not harmful. He also wants the Justice Department to pressure school systems not to require any vaccines before most kids are admitted to school. So public health is politics as well as science, but not just from the right. A new book argues that every fight for a more just and equitable New York City is a fight for public health. Nicholas Freudenberg is professor emeritus at the City University of New York School of Public Health, and he's the author now of Fighting for New York, Activism for Health and Social Justice since the 1960s. He has organized campaigns around issues from childhood lead poisoning to AIDS prevention, HIV prevention, to urban food insecurity, among others. In the book, he argues that fights for housing, higher wages, climate change, and other things are all fights for health. Without them, he writes, the city would be a less healthy, less just, more polluted, and less safe place to live. Professor Freudenberg, congratulations on the book. Welcome back to WNYC.
Thank you. It's great to be here, Brian.
I will ask you about some of the public health stories in the news right now, but why tell the story of New York through public health in your book?
Well, I think there are 2 things. One, New York has been the starting point of many of the most serious public health crises facing this nation: the AIDS epidemic, COVID, the gun violence that you were talking about just a few minutes ago. And so I think focusing on New York City gives us an insight into many of the most serious public health problems facing the nation and the world. But also, New York is the incubator of many innovative solutions to public health problems and the birthplace of social movements to fight around health and social justice. So I thought a focus on New York City would both help us understand patterns of health and disease in this city, but also perhaps reveal some lessons that would be helpful for activists working in other parts of the country and other parts of the world.
And to that point, you structure the book around strategies that activists have used to organize around their goals, and then you highlight a group you think embodied that particularly well in various instances. So let's take ACT UP, for whom the focus you chose was how the activists decided to fix the problems that they identified with the HIV response back in the 80s. Can you give a few specific examples of ACT UP actions and what they set the template for others?
Sure. And ACT UP, I think, was both a controversial and provocative, but remarkably effective group in dealing with the HIV epidemic that hit New York in the late 70s, early 80s. I think there are a few things that stood out for me around ACT UP. One was their ability to attract different constituencies: men who have sex with men, drug users, family members of people with AIDS, and to forge common ground in identifying the problem and solutions across those different constituencies. And that really, I've seen as a characteristic of the effective social movements around health. They can bring together different groups. I think another characteristic that made them effective was their ability to work on multiple levels. One of their early actions was a demonstration at the Food and Drug Administration in Washington. They were willing to go beyond New York City to act on the federal level to urge the FDA to go through a more expeditious review of new drugs, because at that time, people with HIV infection felt that they had a death sentence. And so if there were new drugs coming up, they wanted to be able to get them quickly. And so they, through demonstrations, but also through talking with scientists, they were able to convince the FDA to expedite that process. So those are a few of the things that I think ACT UP did, both to define the problem and to come up with realistic solutions they could work on.
By the way, I don't know if anybody who didn't come up at that time knows that ACT UP stood for something. It was an acronym, and it was AIDS Coalition to Unleash Power. ACTUP, ACT UP, AIDS Coalition to Unleash Power, just as a footnote to history. But
right. And that name, I think, the power in it is an issue that some activist groups are reluctant to confront, but ACT UP put it right in their name. And I think groups that see building the power to challenge the special interests that often benefit from harming health is another important lesson from ACT UP.
Yeah, I'm glad you reminded us of that in the book and the whole name. And even before ACT UP, which was a 1980s group, that same relationship to power and willingness to be provocative, but then work for solutions within the system as well. You know, you trace it back to the 1960s, as the subtitle of your book says, with groups like the Black Panthers and the Young Lords, right?
Yes. The Young Lords was the first group I profiled. And I think they played a really important role in demonstrating that it was possible to mobilize communities, in their case, Puerto Rican communities, but beyond Puerto Rican communities, around the range of health issues, from garbage in the streets to inadequate health care to housing that led to children being lead poisoned. And they were able to show that you can bring communities together out in the streets, making demands on the city government, and winning some victories, which we can talk about as well.
And listeners, anybody want to chime in here with maybe a story of your own or a question for our guest, Nicholas Freudenberg, Professor Emeritus at the City University of New York School of Public Health and the author now of Fighting for New York, Activism for Health and Social Justice since the 1960s. 212-433. WNYC, call or text 212-433-9692. Anyone have a story? Anyone who goes as far back as having been in the Young Lords in the 1960s, or the Black Panthers at that time, or ACT UP? Certainly I know we have those. And want to talk about a public health win that you were involved with as any kind of activist, or just ask a question of Professor Freudenberg, 212-433-WNYC, or related to today, 212-433-9692. Call or text 212-433-9692. By the way, to this idea of how widely you define public health and health activism, it's not just things like AIDS and food distribution, but you include housing, policing, labor rights. Why all of that under a public health umbrella?
I think there are two reasons for that. One is, I think if you talk to and listen to ordinary people, their health is shaped by the totality of the circumstances in which they live, their housing, their availability of food, the air they breathe, their working conditions. It's not limited to the healthcare you receive or your individual health behavior, smoking or drinking. So I think that broad definition speaks to people's experience and to what moves people into activism. Second, within public health scholarship, and I'm a public health researcher as well as being a student and participant in activism, I think there's been a growing recognition in academic public health circles that what is called the social determinants of health, the living conditions, the life circumstances of ordinary people, is really the fundamental determinant of patterns of health and illness in populations. So if public health as a field and if health activists want to be effective, we need to take on those fundamental determinants of health.
To present issues. And I'll note your book came out this summer in the midst of obviously a really polarizing time in public health. I mentioned in the intro the executive order from Trump from just yesterday on vaccines, which seeks to break up the MMR vaccine into 3 shots and seeks to use the Justice Department to end vaccine mandates for kids entering schools. How does and obviously your book came out before that executive order, but in the midst of Trump and RFK's current reign, how do you think what you wrote about in a history book most applies to today?
Sure. And I think what motivated me to write the book was the feeling, certainly more so after 24, but really over the last period, that we in New York City and the nation face really a cascade of health problems that look as serious and worrisome to me as any I've seen in the 50 years or so that I've been observing public health. We have the climate emergencies, the heating, the air pollution from wildfires, the outbreaks of explosive diarrhea, of hantavirus. And so I was really concerned that there was concerted undermining of public health. And I think the Trump administration, Trump and RFK, really illustrate that, because not only have they been undermining the science and the evidence that undermines public health, but they've also been cutting funding for Medicaid and SNAP, for example, throwing people off those 2 life-saving programs that protect people from falling into poverty, and as well as changing the recommendations around vaccinations, cutting what Medicaid reimburses for. So I think there's really a concerted threat to our healthcare system and our public health system. And what I have observed over the years is that activists are an essential part of the response to threats. And what I came to believe from my study of New York City since the 1960s is that the antidote to deteriorating public health is health activism, people mobilizing to give sympathetic government officials what I call the chiropractic function, strengthening their backbones to say no to undermining public health, but also to making officials feel that there's more to lose in terms of votes, campaign contributions, media coverage by attacking public health than to gain by giving in to the elected officials and the billionaire investors who look to undermine public health.
Here's a history-oriented text from a listener regarding your history-oriented book. It says, I hope you highlight the late Denise Oliver Velez, who was a fierce member of the Young Lords, sadly lost to cancer this year. She told me many stories about her East Harlem public health activism in those days and online forums around the 2022 midterms and 2024 election. Is that someone who you write about or even know about?
Yes, and there's a photo of her in my book. And the Young Lords were particularly important in bringing a feminist perspective to struggles in Black and Brown communities, really important. And they set the stage for future developments, both in the women's movement and in movements of people of color. I recently wrote an obituary for Denise in the Common Dreams. And I think learning from activists who have come in the past is a really important way for those of us who do activism in the present to absorb their lessons and admire their contributions.
Nice. Another history question from Greg in Greenpoint. Greg, you're on WNYC. Hello.
Hey, Brian. Thanks for taking my call. And thank you for coming on the show. I have to say to my chagrin that I didn't know what the acronym meant until a few moments ago. But my question is, how much do you think ACT UP may have influenced recent activist groups and movements, specifically how it was structurally organized, like the horizontal nature of it, the lack of hierarchy, but also having like community groups. I mean, I think about Occupy, for example, and working groups. So I'm just curious if you have any thoughts on that.
Yes, that's a great question. Thank you. I think every activist group struggles with finding the right degree of organization and the right degree of openness to participation. And I think ACT UP struggled with that dynamic, but was also remarkably successful. They had what they called Monday night meetings every Monday for several years, in which all the constituencies that were contributing to ACT UP came together. And they made very clear that everyone had the right to express their opinion and to disagree with the opinions of others. They also did something unusual from the more structured groups like the Young Lords, in that if a group of people, 10, 20 people, wanted to act on an issue, they had to present their idea, but then they could go forward. And that enabled ACT UP to take on food and housing for people with HIV, to take on AIDS education in the New York City schools, to take on the FDA rules. They were able to work on a number of fronts. And I think when we see complicated, what some people call wicked problems like the AIDS epidemic, having the capacity to respond to many dimensions is really important. And ACT UP figured out how to do that. I want to say one other thing about ACT UP, which I think was a really important contribution. They were brilliant at communicating to the public. In the days before social media, they had posters on New York Times boxes criticizing the Times for their coverage. They had a handprint saying, to the Commissioner of Health at the time, how many people did you kill today, by the limited definition of AIDS that commissioner proposed. So I think there were lessons for activists on how you communicate effectively across constituencies and populations.
Right. And we talk about the origins of ACT UP and those things you were just describing as having a 1980s or 90s context, but we should note that ACT UP is still an active group, right?
Yes, ACT UP still has a presence, and they work closely with many other groups who take on the constellation of issues that affect people living with HIV and at risk of HIV.
Which actually makes me think of COVID-19 activism, because, of course, we had the COVID-19 pandemic, and you cite in the book's introduction that by the end of 2025, the virus had caused more than 47,000 deaths in New York City alone. It's a New York City-oriented book that you wrote. 47,000 deaths, 209,000 hospitalizations, 3.4 million cases in the city since 2020. Meanwhile, Republican senators in Congress are trying to nail down Dr. Anthony Fauci, formerly the nation's top infectious disease doctor, and put him in jail. And these senators are painting the precautions against the disease itself as more harmful than the virus. And yet, despite this, there are still activist groups in New York City and beyond organizing around clean air in such a way to prevent airborne illnesses like COVID, masking in health settings, and more funding and research for long COVID. So based on the histories you looked at in the book, what would you say to the activists still organizing around these COVID issues or COVID adjacent issues in 2026?
Well, I think clearly what we learned from COVID is we can't necessarily predict what the next epidemic or pandemic will be, but we certainly learned a lot about the importance of a timely response, the importance of being guided by evidence. And I think while I'm very worried about the threats to health in New York City and the nation, I think we have some really important opportunities. We have activist groups working around COVID, around AIDS, around sexual and reproductive health, around mass incarceration. There is just a hotbed of activism in New York City. Too often, however, those activists are siloed, each on their own issue. And I think the opportunity we have, and an opportunity highlighted by the Mamdani administration and their commitment to improving well-being and affordability for poor and working people, to put together a movement that has a vision that's different from the cruel, anti-science, harmful agenda of the Trump administration and some of their supporters. So I think we really have an opportunity in New York City to demonstrate a different vision of health and a different agenda for health than is coming from Washington. And I hope in the next 2 years, as we move towards the 2028 election, we in New York and people in other cities can articulate that vision so that voters will be clear about what the choices we face in 2028.
One more call. Jenny in Brooklyn, you're on WNYC with Nicholas Freudenberg, professor emeritus with the School of Public Health at CUNY and author now of Fighting for New York, Activism for Health and Social Justice since the 1960s. Hi, Jenny.
Hi, thank you so much for having me on, and thank you for having this guest because it's so important. I'm a social worker. I've worked in healthcare for my entire career here in New York City, and I'm also on the board of Physicians for a National Health Program and advocate for universal health care and specifically the New York Health Act, and I really appreciate what you just said about the siloing, right? Where we really don't, there's a lot of silence, I think, around healthcare activism here in New York City. And part of it is that we're not getting the support from elected officials, right? We just had 450,000 people lose their coverage when they ended the essential plan in New York State. And even though we have a democratically controlled state legislature, they did nothing to cover those people. So they all lost their coverage as of July 1st. But we are not hearing a lot about that, right? It's happening in a lot of silence, it feels like. But we know that, the New York Health Act could cover that. But Mamdani, who was supportive of it when he was in the state legislature, is now silent about it. And I think there's we can't, it's maybe not possible now, but it's certainly not possible if you don't do anything about it, if you don't try to make it happen. So I just want to hear what you have to say about that.
Thank you, Jenny.
I agree
Professor?
with you, and I share your concerns about what will be happening both with the loss of Medicaid coverage, the loss of the ACA subsidies, compounded by loss of SNAP benefits. And in other work, I focus on the impact of those changes on our 240,000 students at CUNY, where it will really compromise their ability to pursue their educations. I think the universal health care, the New York State Health Care Act plan has been approved by the legislature, the New York State legislature, multiple times, really in the last 30 years. And in my book, I do
Wait, it's
profile,
never passed the legislature and gone to the governor's desk, has it?
It has not gotten past that. And I think the reason is that some of the special interests, the medical empires, the health insurance industries aren't willing to say yes to trying this out because they will lose their profits. And I think this is an opportunity. And the 26 and 28 elections are an opportunity for us to do it. And I'm maybe more optimistic because I think there is a large number of activists who are saying enough, enough with undermining what people need to live. Mm-hmm. And so I'm hoping 2028 can be the time to move forward on universal health care. And we in New York City have the largest public hospital system in the country and the most accessible to low and middle income people. We, at the same time as we're pressing for universal health care, we need to ensure that our public hospital system in New York has the support, the staffing to provide the care that's needed, and especially to folks who are losing coverage. And that's something that every legislator in the city council and the state legislature and the mayor and the governor ought to be focusing on to help those people who are losing federal support in the coming time until we have a different regime in Washington who can take the concerns of ordinary people and assign a higher priority to them.
And I have noticed, just as a matter of political analysis, that Medicare for All was really not a campaign plank of the Kamala Harris platform in 2024, certainly, and it was not being run on by congressional candidates hardly at all in 2024. It is back in 2026. Not for every Democratic congressional candidate, but it's more part of the discussion. And this is, listeners, whether you support the idea or not, it is back politically much more in the mainstream. So we'll see how that flows to 2028 and the presidential election. So we're just about out of time, but can I get one quick response to you on the Trump executive order, obviously with RFK's support and input, to break up the MMR vaccine into 3 separate vaccines, measles, mumps, and rubella, and whether that would be damaging to kids? They're not saying you can't get it.
Yes, it would certainly be damaging because each additional requirement that is on a family is a burden. And so to have to 3 times go to the doctor, 3 times make an appointment, 3 times ensure that whatever insurance coverage you have will actually cover it, it's tripling the burden. And there's no evidence for this. This is contradicts all the evidence we have. And instead of figuring out ways to protect people's health care and protect people's access to food, what the Trump administration is doing is moving things backward to make it harder for families and parents to protect their children. So I think, and it speaks to a larger concern about the role that evidence and science will play. And the attacks on Fauci are a really alarming possibility. Rather than look at all the failures to address the COVID pandemic in the first Trump administration, rather than looking at the series of infectious diseases that are affecting the United States today, rather than looking at the threats to food safety, they choose an act that will make it harder for families to take care of their children.
Nicholas Freudenberg, Professor Emeritus at the City University of New York School of Public Health, and the author now of Fighting for New York, Activism for Health and Social Justice since the 1960s. Thank you for joining us and talking about your book and talking about the news.
Thank you so much for having me, Brian.